Have you ever wanted to get to the root cause of your GERD? Well, find out on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello, and welcome to Digest This. I'm Dr. Liz Cruz, and I've got Tina Nunziato sitting right here by my side. Today, we have a guest. We have Dr. Amanda Scott, and we just want to welcome you, Dr. Scott. Thank you for being on this podcast with us.
Yes.
So excited.
Thank you for having me.
Yeah, absolutely. So I had the chance of talking to her. Gosh, has it been a few months already? I think it's been a few months, but I was fascinated by what she was doing. So Dr. Scott has her own practice. It's called Covet Health and Wellness, and she practices out of Florida and Massachusetts virtually. You got to love this new age where everything can be done virtually. You can reach so many people, so many more people, I think. She is a naturopath, and she loves the gut. And so, of course, we love the gut. And so that was one of our things where we connected. And we invited her to be on this show with us. We asked her to share with us about her journey. And one of the topics she picked was on GERD and the root cause of GERD, which I think is fascinating. And so we're very excited. Dr. Scott, thank you so much for being here.
Of course. Thank you so much for having me. And I'll share too, I think sometimes the term root cause can feel a little bit charged in this day and age too, where sometimes in the naturopathic community, we obsess over this root cause. And sometimes in the Western community, it's like, these NDs are obsessing over this root cause, but like really what's going on? And how I think about it is that, and kind of what the philosophy of naturopathic medicine is that the body has the innate ability to heal itself. And what that really means is that we have all of these systems, right? We have the digestive system, we have the immune system, we have the cardiovascular system. All of these systems have this innate and beautiful way of functioning. And from a naturopathic approach, we think that if we remove the barriers to that system functioning properly, it has the ability to heal itself. That doesn't necessarily mean that there is not a need for different medications and things like that in Western medicine, but we really do believe that working on helping people improve these things and reduce those barriers to healing is a way that we can improve outcomes and help people live a better quality life. So when we talk about the root cause of GERD, maybe it's not, there's this secret one thing that causes it. But in my experience, it's not always, or it's not a deficiency in something like a PPI or an H2 blocker, which are two of the most common medications that treat it. We don't want people to have to use those things forever. So it's really working on uncovering the different things that are going wrong in the body that might be contributing to that GERD or that reflux.
Yeah,
so that's
beautiful.
I love that.
Yeah, I know. I wanted to ask you why this specific topic, like why did you want this to be one of the things we talked about?
Because so many people suffer from it.
Yes.
And I have had many cases of it, and all of them are so different, but I have had a lot of success with it. And it really just comes down to figuring out the why behind what somebody's experiencing. And like I said, it's very different in every situation. So we can kind of talk about all of the different areas that might need support in the body that contribute to it as we go through this conversation as well.
Awesome. Yeah, thank you.
Yeah, so go ahead. I mean, tell us kind of what your thoughts are and what you've experienced. We'd love to hear it.
Yeah. So a lot of the time when we think about GERD, again, we are, when you go to your doctor, they're going to prescribe you something that's going to reduce acid production. And the whole thought of it is the acid production, the acid splashing up, it's giving you these symptoms. It can cause damage to the esophageal lining and things like that. From a naturopathic standpoint, we think about a lot of different things, and there's a lot of research behind different things that might impact acid balance in the body too. So two of the most common medications that are prescribed when you go to the doctor for GERD are going to be proton pump inhibitors, which are going to basically inhibit the acid secreting mechanism that's going on in the stomach lining, or H2 blockers, which are going to be medications that are going to block histamine receptors that are going to change how your body's interacting with acid as well. PPIs being the much stronger medication, H2 blockers being a little bit less strong. PPIs, when they are taken long term, they're not supposed to be taken long term. But the problem, and why I really wanted to talk about this, is that many patients are put on them for years, if not their whole life sometimes, right?
Decades.
Yeah,
Yeah.
absolutely.
Decades. And Dr. Liz, you know what the bad things that can happen is that we are not absorbing all the nutrients that we need. So it's really common to see magnesium deficiencies and iron deficiencies, and people aren't digesting protein properly and things like that because stomach acid is really important. Right. So it's important to figure out the why behind the acid imbalance and not just, kind of cover it up. But again, these medications are still important because if you aren't controlling the acid mechanism there, it can put you at risk of something called Barrett's esophagus, and potentially then develop into a throat cancer. So it's important that we get these things under wrap, but we don't want to put somebody on a suppressing medication for too long because there's negative effects that come with it too. But at the same time, when somebody's having this reflux, this imbalance of acid, it's telling me that, hey, the body is talking to you and it's trying to tell us that something needs some love, something needs some support, and we need to figure it out. So some of the common things that I see in practice is that there is an impact and function to something called the lower esophageal sphincter. And basically, it's a little flap that's going to separate what's going on with acid in the body in terms of its ability to get out of the stomach and to get up into the esophagus and cause those reflux symptoms that a lot of us experience. And for some people, it's as simple as they need to stop consuming things that are going to impact the integrity of that sphincter. So that's going to be things like coffee and alcohol and spicy foods and things like that. And
Even
for some people, even chocolate, caffeine as a whole. So things like that. And sometimes people just go off of those foods and they're 100% better.
Right.
But sometimes they're not. So other things that can impact that lower esophageal sphincter integrity are going to be things like increased intra-abdominal pressure. So what does that mean? That means a change to pressure in the abdominal cavity. And all different things can impact that. So maybe you're eating meals that are too large and your digestive system can't push things forward properly. Maybe you're holding on to extra weight in the belly and that's putting more pressure on things as well. Maybe you're pregnant and it's something that's a short-term thing. And, the growth of the baby is starting to put pressure on that digestive system too. Maybe you're sitting too often. Maybe you are wearing clothing that's too tight. So anything that's kind of constricting that area and causing a change in how the abdominal organs are sitting can absolutely change the pressure in that cavity and then cause imbalance in what's going on with acid and that lower esophageal sphincter integrity.
So are you referring you're referring to pressure? Could that also then equate to a hiatal hernia, or are you getting to that?
Hiatal hernia is also something that can contribute to it, right? So that's more of like a structural cause of what's happening. And just to kind of explain for the viewers, that's going to be when there is a herniation or a traveling of part of the stomach up into what's happening in the diaphragm. And that's going to contribute to imbalance of acid and how the sphincters are functioning as well. So yes, and that's something that can be diagnosed with imaging. And there are some physical medicine type adjustments that can do to help to correct that as well. So yes, pressure, change in how the anatomy is functioning and or sitting are something that can contribute to that acid imbalance. And I call it acid imbalance because there are some schools of thought that believe that maybe there's too little acid and that's changing what's going on with the trajectory of digestion, because digestion is a very delicate and intricate process. So anything that's kind of throwing things off there can cause imbalance. And sometimes it's not that there's a lot of acid, it's just that the acid's uncontrolled and it's coming up. So that's one of the big ones there. Some of the other things that I definitely see in practice are going to be the impact of stress. So stress is something that will impact gut motility. Motility is the movement through the gut. So when we're not eating, there is a system that is active called the migrating motor complex. And what that is basically how the gut is going to be propelling the food that we eat through the intestines and creating our bowel movements. And that's part of digestion and absorption and all of those important things that come from the food that we eat. So when we're stressed, that is something that's going to impair the connection between our fight or flight and our rest and digest response. And it's going to throw everything for a loop. So again, it's what's going on structurally? Are the organs being changed around in terms of their direction and where they're supposed to sit, and impacting what's going on with that lower esophageal sphincter function and allowing for acid to kind of slosh around in the way that it's not supposed to? Are we more stressed and it's altering our whole digestive pattern and allowing, again, things to kind of be thrown off and get a little wonky there? So all of these things can contribute to it. The other big thing that I'll throw in is that there can be changes to the gut microbiome. So the gut microbiome is one of my favorite things to study in the world. It is very, very cool.
Spend your whole career studying
it could be your whole career. It really, really could. Yeah. But the gut microbiome is basically all of the residents that live in your gut. So the bacteria that are taking up residence in your intestines and contributing to how you digest different foods, how you absorb different nutrients, how you make some nutrients, and very, very much can contribute to gastrointestinal symptoms. So the gut microbiome is something that I look at a lot if I've ruled out things like stress, which we can't rule out with most people, as well as any of those other, anatomical imbalances as well. And in my practice, I will often do a gut microbiome analysis where you send a stool test in and we can see all of the bacteria that are living in the gut, what they're making, what they're not making, and we can really understand what your symptom trajectory is as well. One more thing that I'll throw in there while I'm giving it all to you on a platter is something called SIBO, small intestinal bacterial overgrowth. So I would say in many of the reflux cases that I see, we also find SIBO. And SIBO is a overgrowth of bacteria that's supposed to be in the small intestine, but it's not supposed to be there in such a high level. And it will contribute to reduced absorption of different vitamins and minerals and things that we need. It will cause bloating most often, can cause constipation and or diarrhea, and it's a result of impaired motility for various different reasons. And that's that movement in the gut that I was talking about before. So oftentimes I have worked to treat somebody's SIBO, eliminate the SIBO, and then the reflux that they've had their almost entire lifetime just goes away. So there's a lot of different things and flavors and understandings to like a root cause of what might cause a GERD. But in my mind, it's more of what's going on in terms of the balance of the system that it's allowing for this imbalance of acid to happen that contributes to these reflux symptoms.
That is beautiful, beautiful summary that you just gave.
And it's nice to hear it from you and not from us all the time.
Yeah. It was awesome. And there are so many things. And I will tell you, because I do thousands of endoscopies, 95% of people have a hiatal hernia. It's so common. No, I mean, most of them are small, but I always explain to them, look, you've got the very top of your stomach now sliding up above your diaphragm, and that creates like a little pocket. So you get some extra acid and other juices from the stomach that can hang out there. And it definitely can anatomically affect the integrity of the lower esophageal sphincter. And so it is so common. It's crazy. I mean, young to old, I will scope, and it is really a common finding on the endoscopies. But it was a beautiful summary. I'm just curious then, how do you, when someone comes into you that's had GERD, and like you said, everyone is unique and different. It doesn't matter how many come in there. Everyone has a unique story and a unique journey they've been on. But in general, like are you from the start, like, okay, let me rule out SIBO, let me do this. Like, how do you approach them when they come to you?
So I would say that it completely depends on where they've been. And what I mean by that is, have they explored things already? Have they ruled certain things in and out? Have they had a scope? So it just kind of depends. But from a naturopathic approach, a term that we use and like kind of a philosophy that we use is we establish the conditions for health. So not every single person that comes into me with any kind of chronic gut issues do I just throw, a functional test at them like a gut microbiome test. Sometimes, yes, if it's like been a deep-seated issue for such a long period of time, I'm like, okay, we just need to get a look at what's going on here, right? Especially if you've had a scope and you haven't found anything, because a scope can't see what's going on with the gut microbiome. You can, sample for things like H. pylori, which can be another really, really big cause of reflux. But when they take a sample, as you know, it's only from a certain place. So sometimes we can find H. pylori like on a stool test, and what have you. So I think that the gut microbiome testing is helpful, but I'm glad you asked this because I don't start everyone on that right away. What I start with is establishing the conditions for health. And what that means is, are you getting clean water? Are you eating meals 3 times a day? Are you getting the nutrients that you need from your meals? What kinds of meals are you eating? Are you eating Chick-fil-A for lunch and then, Taco Bell for dinner? And are you on the run when you're eating those meals? Because all of these things are going to impact what's going on with our digestion. So we want to establish a baseline of the foundations of healthy living before we really go and do a bunch of crazy things, because more often than not, we correct that, I don't want to say unhealthy living, but those imbalances in terms of our nutrition and our stress and all these different things, and symptoms get better. But sometimes they don't. And sometimes it is more of a deep-rooted issue. So oftentimes I will get somebody started on, a good balanced nutrition plan. Make sure that they're utilizing stress-reducing techniques. They're exercising, they're moving. They're not just sitting at a desk all day where their, digestive organs are all compressed. So we work on all those different things first. And then if things don't start to correct, and during that process, I might use some herbs and things like that as well, different nutraceuticals. And if that doesn't correct, then we need to take a deeper look. So I might do SIBO testing. I might have them go back and get another scope with their GI doctor to just recheck things and see what's going on. I might do in-depth gut microbiome testing. And then from there, it's a plan that's very specific by the person and what their body's telling me and what their testing's telling me in terms of how I treat the case.
That's awesome. That's so great. But one thing that I've been asked so many times, so I want to get your opinion, is as far as treatment, is what's your opinion on apple cider vinegar?
So I don't use it so often in practice. I would say I more often use it for blood sugar support. So if somebody, the acetic acid in the vinegar has been shown in some research to slow the rise in blood sugar after a meal to some degree. I wouldn't say that I use this all the time though. And I also don't think it's a health food. And if you're somebody that's having acid imbalance of any kind, that could cause more damage than good, right? And a lot of people are just taking a shot straight. And this is not me demonizing at all. I think it works for some people.
Sure.
I have one patient who I didn't tell him to use it. He was a case that had SIBO and long-term GERD, and we treated the SIBO and the GERD is gone. But he just finds that if he's having worse GERD symptoms and he uses apple cider vinegar, it gets better. Maybe that's anecdotal. Maybe there's something to it. But I don't use it so often. But if a patient feels called to it and they use it themselves, that's fine. But I don't think it's a cure-all for everything. And again, that's just my opinion. I think that everyone in the natural community has different opinions on things. So I wouldn't use it to treat GERD. If we're talking about low stomach acid, I want to figure out exactly why the person has low stomach acid, and I'm not going to give that as a stomach acid replacement. I would say that I would reach more for a digestive enzyme instead of a apple cider vinegar. But if the person refuses to take pills and that's all they'll do, then maybe it's something that's worth a try. So it's kind of a runaround answer a little bit. But I would say it's not something that I reach for as the first thing to use for somebody. I think of it a little bit more as good as a salad dressing or something like that, mixed with something that's a little bit less.
Thank you
for sharing all of that. Yeah. And we're going to have you on an upcoming episode too. We're going to talk about a different topic, which I'm excited about.
Thank you so much, Dr. Scott, for being with us. So much great information. I love your very thoughtful, detailed, methodical, I don't know if methodical is the right word, but definitely full of compassion way of approaching your patients. So thank you so much for everything that you shared. And if you have not rated this podcast, please rate us. Please give us a 5 so that other people just like you could find us faster and enjoy these amazing episodes with our guest speakers. And if you have not subscribed, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.